Now we're just going to be transitioning to our next venture. We have Human Edge coming in. We have Dr. Marcus Rainey, who's going to be speaking here. And also we have Dr. Marcus Rainey actually calling in, and we have another member of the team sharing his screen here. Are y'all ready to go, Marcus and Angad?
Yes, I am. Can you hear me, Alessandro?
Yes, I can. Thank you so much for coming in. All right, this looks great. The Human Edge is an enterprise tech company focusing on optimizing the health and well-being of the global workforce. And thank you so much for joining us, Dr. Rainey.
Thank you very much. Hello, everyone, from a very wet and windy Dublin. I am on the other side of the world to where I should be, which is at home in probably an even wetter and windier Mumbai, undergoing the monsoon. And for 3 years now, Human Edge, a company that I founded in 2020, has been building in India, servicing to the world, a journey that we're very excited to share with each of you today. Now, my journey as a physician has been one which has been over 20 years, a journey trying to change the paradigm away from sick care towards one around health, longevity, and well-being. It's been a journey that's taken me to different parts of the world, something that I've learned a lot about my own biology, and then translating that back into the people that we work with and serve through Human Edge as well. But whilst I've been on a journey, the world over the last many years has also been on a journey since 1960 that we've seen the average lifespan for us increase by 19 years. But what's been really interesting, and this was a study done by McKinsey published very recently, is that whilst there's been an increase in the number of years that we've lived, there has been a very significant increase in the amount of time that we spend in moderate health and in sick health as well. We, as physicians, are seeing the world arriving at a sicker place earlier on in time. Chronic diseases are happening earlier. And whilst we're living for a longer number of years, we're actually sicker, therefore, for a number of years as well. Now, this is introducing a new narrative into society, something that's called health span. Health span is this idea of the amount of health that we have in our years, not just looking at time spent, but looking at the quality of the time, the healthiness index of people. And this is really important because now we hope that we can continue to propagate this idea where physicians, clinicians, and the healthcare system is focused not just on the lifespan, but the actual health coefficient, the health span number as well, which is illustrated in this particular slide. So 3 years ago, I founded Human Edge. And over those last 3 years, we have been building our hypothesis, we've been building our product, but we've also been building our market and channel partners that we bring this product towards. You can get a little sense of this in this description, but in 3 years, we've proudly been able to partner with almost 60 large corporates around the world. Our business model today is one where we work with our corporate partners to provide an impact to the employees that work for them in over 14 countries, impacting the lives of close to 55,000 knowledge workers across some of the companies that you can see here. And I'm very grateful for KPMG for supporting this platform today. And we're very proud to be working with them for 3 years now in India and impacting partners that work with KPMG in this part of the world. So that's been the journey that we've been building, our hypothesis, our product, and our market as well. And this is important because if you can see on the next slide, the world is aging. Now, by the year 2050, we will have over 2.1 billion people who are age 60 and above. By 2030, a fifth of the population of the United States will be at retirement age. And rather than wait for where the hockey puck is going to land, it's important to start and understand where it is today. And those people are aged between 30 and 50 years old today. And this is really important because if you remember that slide that I showed you earlier, which was the McKinsey study looking at moderate and sick health, a lot of the changes that happen in our trajectory of health actually happen in our third, fourth, and fifth decades. So that's the target audience that we build our solutions around today. These are people who are currently age 30, 40, and 50, because our goal is to impact their life today so that we can drastically influence the trajectory of their health thereby not just helping them extend their lifespan, but increase the health coefficient of those years as well. So what does our solution look like? The next slide can show you what that solution looks like and what this audience looks like first. Sorry, we'll go back to the last slide, what our audience looks like. So this is someone aged 30 to 50 years old. They're living in an urban city in a metropolitan area. Their current health is one which is moderate or languishing. And these are some of the languages that we hear from the patients and clients that we work with. I just don't have enough energy to play with my kids, or my body is changing. And I won't read all of the stories, but it's basically this idea that I would like to feel like my younger self today. And we don't have to do the status quo, which is just do a set of diagnostics and be told that that's just old age or because we're growing older. We can actually make changes in our lives to transform life by building good lifestyle practices in ourselves. So the next slide, we'll look at the solution. So our solution is one which is proactive. It's not reactive in nature. It's about personalizing ourselves to manage the care of people by introducing them to this idea that you can transform your life by transforming your lifestyle. The different areas that influence our health, which is not drug-based, but lifestyle-focused, simplifying health for them, making it easier for them to understand where they are today and the interventions that are needed for them. But that's where we are today as a company. Our vision is to democratize this through the technology that we're building so that the same capability can be put in the hands of millions of people around the world, and they can enhance their own health span through this journey as well. If we go to the next slide, we'll get a better idea as to where the competitive landscape is currently, because there is a lot going on in the longevity space around the world. And we've just included some of those players that are out there. But what you'll notice is that there is a missing gap. There is a missing gap in this understanding that health has to be delivered with the right behavioral methodology, with the right coaching mindset. And it's not just about raising the awareness, it's actually driving people towards better care and managing that care with them in an accountability matrix as well. So right now, we have two particular solutions that we have in market that we're providing to the different partners that we work with. Our flagship solution, which is where we started in order to build the hypothesis and the product, is one which takes people on a 100-day journey that they can increase their health span. We do that through integration with wearable devices. We do that through integration with advanced diagnostics. And we use this information to personalize a plan. They then work with a health coach and a health manager to improve their health with the right supplementation and lifestyle interventions that are needed, and tracked via a mobile application that allows us to show them change and improvement. As we've been growing as a company, we've been extending our capabilities, and we now increase our footprint by not just working one-on-one, but working through the mobile application that you can see here with larger cohorts of individuals. And this is really interesting for people because we've started to introduce a community layer where people can share their journeys with one another. We call them biohacks, small lifestyle interventions or prescriptions which can help improve themselves. And they can do this with one another, with their colleagues at work, with the people that they stay with at home, or their friend circle. And we have this data set that our coaches can then see and prescribe the appropriate interventions when needed based on different trigger alerts that are happening in real time through our wearable integrations that we have. We're currently, if I ask my colleague to move to the next slide, we're currently been a revenue positive company. We've been growing our revenues about 2 times each year. This year, we hope to cross the $1 million threshold, which is an important milestone for a young early stage startup. And what we're really proud of is the stickiness of the relationships that we have with the partners that we've worked with through our corporate relationships. And the principal reason for that stickiness is the ability to measure health and show our partners an improvement in the health of the various knowledge workers that are part of the programs that we go through. We typically provide these services to professional services companies, BFSI, banking and finance, creative edge agencies, etc. Anywhere where human capital is a major need and asset for the organization. But as I said, that's just where we are today. Our journey of productization is one where we hope to be able to unleash this mobile application with other healthcare partners and other channel partners around the world to bring the same benefit to them. So how can you potentially help? We're not currently looking at raising funds. We will be looking at doing a Series A round in the next 12 to 18 months. That's certainly part of the journey towards greater product development. But currently, our ask is twofold. One is if there are companies or partners in your network who you think might benefit from a scientifically led, rigorous platform to enhance lives through lifestyles. And the second is by public health partnerships where we can work with them, understand data to help build the algorithms, the trigger logic, and the rules engines that we have to prescribe the right interventions for people. So thank you very much for your time. And I'd be very happy to answer questions. And this is the website if anyone's interested in knowing more about us.
Thank you so much, Dr. Rani, for the great presentation here. Fantastic to see more about the great work that you're doing. Congratulations on your project, on your progress here. The first judge I'm going to be bringing up here is back at the top of the order of judges. So reintroducing Erica Frankel, Managing Director of Health Design ED. Erica, thanks a lot.
Thank you so much, Dr. Rainey. It's like you've been sitting at my dinner table. This is an enormous passion, particularly of my partner, and I am getting fascinated with it. I wanted to unpack the sort of health equity component of this. I spent most of this thinking, yeah, it's going to create a bunch of haves and have-nots in a different way, right? If I see a future where certain people who can access it end up living longer and healthier, even if we're all living longer. So I know you mentioned you want to democratize it. I'm curious how that works and how you also ensure that some of the interventions that are often sort of costly because of where we are perhaps with them are affordable, or at least that there's interventions that can have the similar outcomes at an affordable way. So just broadly speaking, how do we democratize it?
Erica, that's a fantastic question, and it's something which is very near and dear to my heart, because our ambition at Human Edge, as I said, is to democratize this intelligence. We live in a world where too few people have the affordability and accessibility to the right type of service provider, even if that service provider has the time. And what we're trying to do with our mobile application is, and I didn't have an opportunity to go into that too much today, but if I can answer it here, is to provide the right context and the lifestyle prescription to the right person at the right time. The entire framework of our mobile application is based on the 5 key pillars of good health, which is improvement of sleep, the right type of nutrition, movement, exercise, the environment, which are the people, places, and technologies that you're surrounded with, and your mood and emotion. The prescriptions that we create and the coaching that happens through our health managers are focused on these 5 pillars, because that's where 80% of good health comes from. We're not a platform which is suggesting fancy molecules, which a lot of the longevity type of companies are going towards the direction of. But people have access today to social media, and they're getting most of their learning from, let's say, Instagram, which is telling them everything from a psychedelic mushroom to a cold shower. There's very little scientific rigor. This is influencer-led. And what we're trying to do is bring the right scientific rigor to the right person to contextually simplify that person's health by analyzing the data that we collect from their bloods and their wearable devices and our questionnaires, and then giving them the right intelligence that they can make better decisions about how they improve these 5 pillars. So I hope that's giving you some idea. And these are not expensive things. These are things that are around us. We just need to cognitively be unburdened with the understanding of what I need to do today based on what my health information is telling me.
Thank you so much for your question, Erica. Amy, would you like to come in?
Yes, thank you. And thank you, Dr. Reina, for that really interesting presentation. It was great to see that you're partnering with our firm, with KPMG. My one question, actually, I had a few questions kind of layered onto one another, but sort of building on the last question in relation to health equity. I was wondering, are you considering building any partnerships in order to impact social determinants of health, right? Since we know that so much about health outcomes is not actually contingent on, like individual choices, but also, economic capital and social capital. In other words, kind of the resources that one has access to, and then the communities that one lives in. And then was also curious about, whether you're considering partnering with organizations like AARP, as well as whether there's a behavioral health component to this, or if this is more just focused on the physical. So sorry, that was a lot. I can go back and repeat, but there were a lot of provocative points of your presentation there.
I'll try and work backwards from there. So firstly, yes, there is a lot of behavioral science that has gone into the application. But what I always stress with all of our partners is that we're not a habit-forming application. There are many other people that have habit-forming applications. We understand the importance of nudge. We understand the importance of a community. We understand the importance of accountability, but that's not our hero. Our hero is prescribing the right lifestyle intervention for you. So that was one. The second is we believe that our core strength as a company is the intelligence that we create on the data which is shared with us. It's device agnostic. It happens in a data secure. So we are just on the final leg of HIPAA and GDPR, spot through an ISO certification as well, which is very important to us. So that's our core strength, is as analyzing of data, the interpretation of that data, and then simplifying health for the person. Now, how that reaches the person can happen through a variety of channels. We've just chosen the corporate route to begin with because that presented itself with the most business sense through the pandemic as health as a priority climbed up the ladder in the corporate space. But there are many other partners that we're in conversations with. We're talking to medical practitioners and large healthcare practices as a tool to enhance lifestyle in their patient set. We're talking to insurance companies. We're talking to credit card companies. We're talking to young people, professional associations, etc. Our goal is that the application in its simplest form can be distributed through a number of different partners. And it may just be the case that HumanAid as a company merely is the intelligence layer, and an API or an SDK gets plugged into another digital ecosystem that can provide this as a service either to an HR platform or employee management or patient management or health information system. That could very well be the direction that happens to we go in over the next 3 to 5 years.
Thank you so much, Dr. Rainey. Thank you so much, Amy, for your questions here.